Hello everyone, today topic is hysteroscopy. Visualization of endocervical canal and uterine cavity with the help of endoscope is called as hysteroscopy. We can do hysteroscopy by two methods. One is the diagnostic procedure as a diagnostic and the secondly is therapeutic. For diagnostic procedure, it is done to identify the endometrial polyp, to see the submucosal myoma, for abnormal uterine bleeding, postmenopausal bleeding, if there is any intrauterine adhesions, missing IUCD, etc. For operative procedure, indications can be for to do polypectomy, to remove the myoma, that is myomectomy, lysis of intrauterine adhesions, and removal of missing IUCD. So next we come to distension media. Most commonly used are two. One is a normal saline and the second is glycine. Normal saline, it is a electrolyte media. It is low viscosity media and it is easily used in the diagnostic hysteroscopy, right? But in operative procedures, we tend not to use saline. We most commonly uses glycine, which is electrolyte free media, and also it is a low viscosity media. After distension media, we come to anesthesia. Like some people do office hysteroscopy also. In that case, we don't need any anesthesia. If the hysteroscopy diagnostic procedure is done in OT, then we need short GA with paracervical block. And if it is done as an operative procedure, then we need to have full GA, right? And the patient position is always dorsal lithotomy position, right? Next we come to the basically the steps of the procedure, right? Firstly, the vagina is retracted with the help of the sim speculum and cervix is held with valcellum. Uterine sound is used to measure the uterine cervical length, right? And then we use if we see that whether it is dilated or not. If it is not dilated, we can use Hagar dilator, right? And in diagnostic procedure we don't need any dilatation, so we can insert the hysteroscope, right? We have to assemble it by scope, sheath, all are assembled, and the saline is also connected to it, right? Saline is also connected. Then we start our hysteroscope. Firstly, we will see the endocervical canal, right? And as soon we enter, we should see the fundus of the uterine cavity, both the ostia, and that panoramic view should be seen. If there is endometrial polyp, that should be noted. If there is some mucosal fibroid, then that should also be noted. And right, if some pathology like thing we could see in the hysteroscopy, we should take it as a sample. That should be sent both in formalin and normal saline, right? So this was a procedure of diagnostic. Or if there is a polyp, then you have to remove that polyp and it can be converted to operative procedure also, operative hysteroscopy, right? After doing it, we come to its what are the complication of hysteroscopy. First is the hemorrhage. There can be excessive bleeding, right? Second, the uterine perforation. Thirdly, the electrolyte disturbances due to the distension media, and fourth is the infection that can happen. So hysteroscopy is a very good procedure, and it is a short procedure. It can also be done in the office also, office hysteroscopy, which doesn't require any anesthesia.